Hi, guys. Welcome back for our daily practice questions. It is day 307, and as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q-Banks, one-on-one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolute to medicine. We treat on a patient by patient basis, and any other questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm speaking on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my MP Test Success Toolkit, it is free and linked in the description. My website is also linked in the description and it houses all of the resources that I do offer. And as always, I like to direct you to my business profile by simply going to Google and searching the Nursing Studio. It will bring you here where you can find my contact telephone number, link to my website, and testimonials from previous review students. All right, y'all, question number one. A 10-year-old presents with sore throat, fever, tonsillar exudate, and tender anterior cervical lymphadenopathy. There is no cough. What is the most likely diagnosis? Is it A, community acquired pneumonia, B, mononucleosis, C, streptococcal pharyngitis, or D, allergic rhinitis? Take a moment and tell me what you got, y'all. All right, I always recommend reading the stem of the question first as it allows you to slow down to ensure you're answering what is even being asked of you. So here the stem of the question states, what is the most likely diagnosis? And I always tell you if the stem is looking for a diagnosis, you need to run it back and look at the assessment findings. How are they presenting? What are their signs and symptoms? So here we have a 10-year-old who has a sore throat, fever, tonsillar exudate, and anterior cervical lymphadenopathy. There's no cough. This is classic presentation for a strep throat. So C, streptococcal pharyngitis, right? Remember, the way you differentiate strep throat versus mono commonly is strep throat has anterior cervical lymphadenopathy, whereas mono has posterior. All right, question number two. A 60-year-old patient with type 2 diabetes and hypertension has persistent microalbuminuria. Which antihypertensive is preferred? Is it A, thiazide diuretic, B, an ACE inhibitor, C, a beta blocker, or D, a calcium channel blocker? Take a moment and tell me what you got. Okay, so when looking at the stem, which antihypertensive is preferred? Let's see what's going on. So we have a 60-year-old patient who has type 2 diabetes and hypertension. They also have persistent microalbuminuria, which lets us know not only are they diabetic, but they are showing albumin in their urine, a type of protein. So they need renal protection. So the best answer is going to be B, an ACE inhibitor. Remember those patients who require renal protection, maybe diabetic or have CKD. We want to go with an ACE or ARB to protect those kidneys. All right, lastly, question number three. A 34-year-old woman presents for her annual exam and reports poor sleep, fatigue, and loss of interest in activities for 3 weeks. Which screening tool is most appropriate to use first? Is it A, GAD7? Is it B, PHQ-9? Is it C, CAGE? Or is it D, a Beck anxiety inventory? Take a moment and tell me what you got, y'all. All right, and stem of the question here, which screening tool is most appropriate to use first? So we have a 34-year-old woman. She comes in for her annual exam and she's reporting poor sleep, fatigue, and loss of interest in activities for 3 weeks. Y'all, this is classic presentation for major depressive disorder is greater than 2 weeks. So you want to do the depression risk assessment, which is B, your PHQ-9. Remember, A is for anxiety, D is for anxiety, and then the CAGE is an alcohol assessment tool. All right, y'all. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, Feel free to reach out to the nursing studio. You can give us a call, shoot us a text message, or shoot us an email. And as always, everything that I do offer is linked in the bio of this channel, including my website. And as I mentioned previously, my website is also linked in the description. All right, y'all. Y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.